I am not opposed to insurance companies. We work with them, they play a proper role in this equation, and we also pursue quality-based relationships with the insurance companies. And we'll continue to do that because our patients need us to. But at the end of the day, we have to focus on our patients' needs and how they can get the care they need, and also how we can do that in such a way that it doesn't cost so much. So much of the time, it just has to do with a form that needs to be filled out, or a note for an employer, or perhaps it's a simple referral for a minor problem. It could be a medication change or a refill that needs to take place. There are all kinds of things that might come up throughout the year that could, through a simple process, be solved for that individual. Most industries have mechanisms of doing this, but in healthcare we don't. And here's why. As it stands, most insurance companies only cover face-to-face encounters with actual clinicians. That's all they cover. They will not cover a phone encounter, email exchanges, or any other work that's done. And if you look at what they're covering, essentially it's that face-to-face visit. Well, then the money from that face-to-face visit has to cover everything else. Billing staff, compliance staff, administrative staff, clinician staff, supplies, malpractice insurance, other forms of insurance, and the actual salaries of the clinicians who are providing the care. There's almost none left over to invest in the technology and staffing to provide all the other services that consumers are seeking to make healthcare a little easier, a little more convenient. We think it should become easier. We think it should become more convenient, and we believe we've identified the solutions to do that. Years ago, we thought direct primary care would be a good solution, and it is. We have a lot of businesses and individual patients who are benefiting from our direct primary care option. But most of our patients do have an insurance product, and they want to be able to use that. And we want to be able to help them use it and get the value from it. So there's a gap there. Patients want to have a good visit each year to review their health and have an opportunity to become their healthiest self. They want the opportunity to be seen quickly and have time with their provider if they have a problem that needs to be managed in a face-to-face setting. But if they have simple problems or simple needs, they just want to be able to email or call and get those problems solved and not have to leave work and have to pay a lot of money and have to take time away from the other activities they should be doing. We agree with that. But here's still the problem. None of that is covered by current insurance contracts. Now, some businesses are able to provide those services, but this is how they do it. If they are a hospital or a large corporate entity, then they actually have negotiated much higher fee schedules from the insurance companies. In addition, they are able to pad the charges with something called facility fees, and those are quite expensive. So essentially, they may provide these enhanced services, but what they've done is just simply charged you a lot more for them. You'll notice that if you use a hospital and clinic, that when you pay your bill, it's typically much higher than if you use an independent clinic like ours. And we don't think you should have to pay a facility fee on top of the standard evaluation and management fee. So that we're not going to do that. We're not going to try and find a way just to create extra charges that were not necessary so we can get more money so that we can basically then finally try to make these investments in infrastructure to serve you. We know there's a new way. There's an emerging model. Membership models have become very popular in our time. All kinds of businesses are rolling out membership options for a particular monthly or yearly fee. A lot of services are covered that you would like, and then you don't have to think about them. These models have been very successful, and it's time for healthcare to consider these models. The reason that it's hard to implement them are that insurance contracts are so binding. If we try to do any other type of transaction with our patients that the contract prohibits, then technically we're violating that contract, even if it's a transaction the patient wanted. That's how challenging it is. But we do have a healthcare entity that can offer these services at a very low fee. In fact, if people understood how low the fee could be, that would actually cover the additional staff to answer the phone, the staff to provide telehealth, the time for your clinician to answer an email, the opportunity to get in on the same day and see your actual doctor because they had more availability, more time with your clinician. It's a very small investment. And so we're going to move into this model. Now, it's just one model of many that we offer our patients, trying to meet any of the needs that may come up. Our patients don't have to choose that model. If they don't feel that they need any enhanced services, then it's perfectly fine for them to work with us just through their insurance contract. And we will provide them all of the same levels of healthcare at these face-to-face visits that we provide anyone else. We will make sure we serve them to the best of our ability. But there's a big difference between only using your insurance or being a member of our practice. If you only want to use your insurance, then when you need services, we will invite you in for an office visit. And we're happy to see you. And we'll see you and we'll fill out the forms and we'll make the referrals and we might make the medication switch or answer your questions and help you with that. And then of course bill for our time for the face-to-face care. But if you're someone who's looking for more convenience, we're going to be rolling out a program where for a very low monthly fee, you will be able to have all of those other services in addition to the opportunity to have face-to-face encounters. You'll have the opportunity to have a telehealth encounter to get a minor urgent care problem solved or a prescription called in. You'll have the ability to send an email and ask a simple question and get an appropriate response. You'll have the ability to request a form to be filled out or a referral to be made. And if it's appropriate, we'll take care of that for you. We'll make healthcare easy for you. We want to find the solution. And the way we'll be able to do that is with the nominal monthly investment that is being made in our practice by our clients. We will be able to hire the staff, personnel, and purchase the technology that provides all the services I'm discussing. And it will solve the problem. Now that model won't be for everybody, but I've already talked to a lot of our patients, and many are very excited about the possibility of paying a nominal monthly fee and being able to receive the services that they're looking for healthcare, while simultaneously knowing that they can also come in and see their preferred clinician and have ample time with them. We are committed to the future of healthcare. We are committed to our patients. We refuse to accept the idea that healthcare has to be what it is, or that individual humans have to keep becoming less healthy. We refuse to accept that. We are on a mission to change the conversation about health in our country, to change the idea of what good health really is and how you achieve it, and to absolutely transform the process of how healthcare can be delivered. And we can do this because we remain independent. We own our own business, and we're free to try and find these solutions for our consumers. We, on the inside of our business, have minimal bureaucracy and red tape. We deal with it on the outside, but on the inside, we have a small team of excellent leaders who are constantly thinking about how to give our clients a better experience. I look forward to rolling out this model and teaching our clients about it. And if it's a great fit, we hope you'll become a member of our practice. We hope that we can build a great relationship with a motivated group of patients who love what we provide them and we love serving. That's what healthcare should be. It will restore the doctor-patient relationship. It will allow our staff to be invested in and to work to their highest potential. They'll no longer have to multitask and try and answer 100 phone calls and 50 faxes and try and get patients back into a room and feel like at the end of the day there's always something they may be missing. Instead, we'll have the team of people we need so everyone can work at their highest potential and also receive good compensation and benefits for doing so. I know this is possible. I hope you'll join with us in this. I hope other practices will learn. We'll be hoping to be able to teach other practices how to do this so the other independent practices in our community can offer their clients the same type of service. I want to thank you again for your trust, for your interest, for your willingness to listen to this. I want to thank you for continuing the conversation about how to make healthcare better. That's what we're committed to. We will not give up. We know this cause is worth it, and we know you're worth it.